Okay, now we're going to talk about recording and reporting patient data. Let's see, I'll move this up. Okay, so patient data must be recorded accurately. You need to document the procedures as you do them. If you don't, you'll probably forget what you did or how you did it, how long it took you, how the patient responded. I know from my experience, if I don't document immediately, I forget. Use the proper format and appropriate forms, and everything should be written in black ink if you're writing. Most of the stuff now is typed into a electronic medical record, but sometimes we still do use pen and paper in a paper chart, and it needs to be black ink. Okay, we're going to talk about subjective and objective just a little bit. We covered it in the in another PowerPoint in this unit, but again, subjective is what the subject says it is. So it's things you can't really prove. And objective are things that you can prove. They're measurable. Test, weight, height, vital signs, things you can see, hear, touch, smell, things that we use our senses for. Again, we have not talked about SOAP notes. We have talked about subjective and objective, but we haven't really talked about SOAP notes. SOAP notes are what medical professionals use to sort of document in an orderly fashion about the patient. So S is what the patient will say. I have a headache, for example. Patient states, in quotation marks, I have a headache. O, patient's grimacing, patient's crying, blood pressure is 160 over 90, pulse is 125. Assessment is taking the normal versus the abnormal. What's normal for this patient? What's now abnormal? What's going on now? Sometimes you will see in an assessment, if a doctor is filling out a SOAP note, you may see a diagnosis under A. And then P is the plan, what will be done. Typically under plan, you will see a doctor's orders. If a doctor is filling out a SOAP note, or a therapist is filling out a SOAP note, P will be a plan. It will be an order. For example, physical therapy 3 times a week times 6 weeks. Now, in a nursing situation, a SOAP note, the S and O will be the same. The A will not be a medical diagnosis because we can't medically diagnose, but it may be some type of assessment of what we noticed. We have some nursing care plans that we do, nursing assessments that we draw from, and then the plan may be something that we are going to do with that person. Maybe we are going to offer the bathroom every 2 hours or whatever. It just depends on what it is. It can't be like a doctor's order, a medication order, that kind of stuff, not for nurses. Again, subjective, this is just review. My tooth hurts, my jaw aches, my tongue hurts, I bit my tongue. I feel like I'm swelling. I feel fat today. Just all this stuff. These are subjective. Objective again is measurable. We use our senses for. Assessment again, normal versus abnormal, and then plan. What are we going to do? What's our plan? Okay, these are just pictures where you would choose whether you think it's subjective or objective. I'm going to move this down a little bit. I would say that that's probably subjective. This is subjective, although there are some objectivity to it. She is grimacing. She does look like she's in pain of some type. This is definitely objective because you have a drooping on the right side of the face, which is indicative of maybe a stroke. This is an objective measurement of blood pressure. This is objective because I can see it. I can visually see with my eyes that we have some pus going on here. This almost looks like, to me, it looks like a poison oak of some type. The patient's having a seizure definitely is objective, which means that we can also record it. We can't say the patient's having a seizure. I know it looks like we should be able to say that. Now, if they have diagnosed seizures and you know for sure they're having a seizure, you can probably diagnose that, or not diagnose it, but you can chart that as a seizure. Excuse me. But if this is something that you've never seen from this patient or this person and you don't know their history, you would describe what you see. We can't just diagnose ourselves and say, oh, it's a seizure. The patient is nervous. So this is a subjective thing. I can't really say a patient's nervous. I can say the patient's crying. The patient states he is nervous. Or again, you cannot use opinion when you're charting. It's all factual. I wouldn't say they have dermatitis unless the doctor has diagnosed them with dermatitis. So I would explain what I'm seeing. The patient is cyanotic. Again, this is more of a diagnosis. Oh, sorry, guys. I would say the nail beds are a bluish color. Their capillary refill is less than 3 or greater than 3 seconds. Patient states they have numbness and tingling in the hands. So I'm giving a background to why maybe they are having this bluish. I'm asking the patient, explain your symptoms. I know it looks like you have cyanosis, and you probably do, but I need you to tell me your symptoms. How are you feeling? And then reporting patient data. So this is all recording. Then we're going to talk about reporting. We have oral reports, and this is typically where I'm reporting to one other person about the patients I cared for the night before. Let's say I work nights. The morning nurse will come in the next morning. I tell her about my patients I take care of, maybe some changes in their conditions, lab results, or some things that we're doing. Maybe we're doing a 24-hour urine collection, and I need to let her know that. So I will talk about my observations, patient's results, anything abnormal, that kind of stuff. So we have individual reporting and we have team reporting. Individual is one-on-one. Team is multiple people sit around a table maybe and discuss that patient or what's going on the unit that day. Written reports is what we write down. This is put in the patient's medical record. It's a legal document. We don't have to actually handwrite it. We can type it into an electronic medical record. The information has to be accurate. It can be subpoenaed in court because it's a legal document. So we can amend the record, it's called, and that's if we do that the correct way. We can't use whiteout. We can't scribble through something. You can make a one line through it, strike through it, and then put what you meant to say, or maybe you put it on the wrong patient's chart. But we can't scribble out because it makes it look like you're trying to hide something. All right, so in summary, choose the appropriate tool to assess the patient's treatment plan, analyze the information you gather, evaluate the patient's response to treatment. Maybe you need to revise the treatment plan, and then record and report accurately and in a timely manner. Whoops. All right.